Cardiovascular disease is a leading cause of global mortality, and people suffering from conditions often see a doctor too late. I'm very pleased to be joined by Dr. Kim Williams from Rush University Medical Center to discuss nutrition and cardiovascular disease. Dr. Williams, thank you so much for finding the time to speak on this subject today.
Well, thank you so much for inviting me.
Dr. Williams, why do so many people develop heart disease, and how important is diet?
So it's a very interesting question. Can I just refine one thing that you said in the introduction that not everybody understands? You're absolutely right. Heart disease is the leading killer around the world. Interestingly enough, it's really confined to the low and middle income countries now. And, we've done such a good job of wiping out infectious disease, everything from, parasites to AIDS, and we've done so many things medically. And yet the nutrition and the fact that we have less agrarian societies and less exercise, less workplace effort, physical effort, means that we're essentially getting our lifestyles just set up for heart disease. Now, I said low and middle income countries. There is one exception. There is one high income country on the planet that still has heart disease as the #1 killer, and that's the United States of America. And we export our diet through major companies and fast food, and we export conveniences. And when you have a better way of farming and more leisure activities, and your screen time goes up, the majority of which is coming from the United States, but other countries, high-income countries, are involved in this marketing as well. We end up with poorer and poorer lifestyle. Now, there actually have been some very good detailed analyses worldwide that have looked at the cardiovascular disease burden and relating it to diet. And one of them has said that there's 11 million unnecessary deaths and 255 million disability-adjusted life years because of lack of eating a proper diet. Fruits and vegetables, more grains, less meats, less saturated fat, less sodium. There's some basic principles that anyone could follow. And sure, there are those of us who start off vegan, and then you start listening to the animal rights people, and then you have 9 grandkids like I do, and you start thinking, wouldn't it be nice if they had a planet to live on? And you start thinking about sustainability. And not everybody is interested in just the healthcare aspects of nutrition. But when you put all of that together, it really does make sense for people to take good stock of what they're eating. Now, having said that, if you're just confining it to healthcare, we have such a broad spectrum of poor diet, that the items that I mentioned, any one of which, if you just take one of those things, like drop your sodium or drop the processed meats, make some simple changes, you could actually reduce cardiovascular disease dramatically if we could do this, and that would be worldwide.
In a recent study, you asked an African American population that was considered at risk of cardiovascular disease to stay on a plant-based diet for 5 weeks. In a very short amount of time, you observed significant changes. Can you tell us a bit more about your findings?
Well, so the backup is that, I grew up in the African American community. The Southern Baptist Church was sort of even I'm in the North, was sort of the dominant culture. And when I was growing up, Lent, which everybody's familiar with, but Lent was actually something that Catholics did. It wasn't something that was prominent in the Black community so much. Well, it turns out that investigators at Rush, who were working on in prevention, mentioned some of the work that they were doing on the west side, which, of Chicago, where Rush is, working with churches to give up, simple things like smoking for Lent. For that 5-week period between Fat Tuesday and Easter. And it hit me that, wait a minute, if African Americans are doing that, why don't we try something big? Not to say that they hadn't done some big things. They were talking about giving up sugar-sweetened beverages or soda pop for Lent. That's tremendous. Smoking is tremendous. But I thought I would take it a step further. I found a group that had the culture on the south side of Chicago, near where I grew up, that had the culture of giving up something for Lent. And it could have been, fried foods or just something simple. And I said, well, how many people would be interested in doing something a little further? And we had loads of volunteers. We could afford to actually feed 50 people, 3 meals a day, delivered to their home for 5 weeks. And so we did baseline blood tests and all the vital signs. And then we did a follow-up on Easter Sunday, doing the blood tests. We lost a little bit of data doing that, didn't realize that there were going to be people who signed the consent form, said they'd be there, and then they were out of town on Easter because they had to go visit family members. And this was actually in 2019, pre-COVID, so people were still moving. So we had, 88% follow-up, which isn't that bad. But in those 88%, we had 93% ability to stay on the diet. That is, don't eat anything else. And, people would eat something every now and then, but when you added it all up, it was actually pretty good. So what did we see? We found that the degree of obesity went down. In those 44 people who followed up, average was 10 pounds, or that church was 440 pounds lighter. As it turns out, the blood pressure also dropped by 10 millimeters of mercury. And that actually was clearly mitigated by a number of people who started backing down on their medications. So obviously the impact was even larger than what one would have seen. And that's the important goal. When you do a diet, do lifestyle, hypertension dramatically improves, and you should be able to back down or even eliminate the medications. But everything else that you can think of cardiovascularly, we were able to do. We measured insulin levels, hemoglobin A1C. We saw a drop in LDL cholesterol, triglycerides. Everything that you would want to happen actually happened. But we did one further thing that hopefully everyone is hearing about these days, and because it's so relevant to both pandemics that we're having, and that is TMAO. And if the listeners aren't familiar with TMAO, please put it in your search engine and look at some of the images, and you'll see this idea that started in the Cleveland Clinic about 9 years ago. First publication in the New England Journal of Medicine, saying when people eat animal products, it puts in several components, some of which we thought were good for you: choline, phosphatidylcholine, betaine, and it goes into the GI tract where there's acted upon by the microbiome, that is the bacteria that are in the GI tract. They make a compound based on the animal protein, essentially. They make a compound called trimethylamine, and that then goes to your liver where it's oxidized. So trimethylamine in oxide, it turns out, correlates very well with bad outcomes. So far, and this is still developing, so far it's heart attack, stroke, heart failure, chronic kidney disease, and death. And if it wasn't for those five things, eating animal products would be just fine. Or if you could eat animal products and not develop a bad microbiome that produces this stuff. So it turns out that the vegan diet changes the microbiome in a matter of a couple of weeks or less. And the bacteria that are in the GI tract do not produce TMAO or TMA. And so as it turns out, we measured, we had the science, we had our vendor able to do the TMAO levels. It took them a while, but they had them frozen. And when they got the assay, they were able to do it. And that, lo and behold, had a 43% decrease in TMAO levels, which means that their risk of developing a future event would have been tremendously low if they were able to sustain that kind of diet and sustain that low TMAO level. So I'm encouraging everyone to look at the TMAO story as an entryway to looking at the microbiome, because for cardiology has essentially been chasing down hypertension, obesity, high cholesterol, diabetes, and chronic kidney disease for decades, not realizing that they were all coming from the microbiome. And guess what? COVID illness and COVID mortality are related to the microbiome. And if you have the good kind of bacteria that don't set up inflammation, you don't get cytokine storm. Hence the recent publication saying that vegans don't die of COVID, and very rarely or very unusual for a vegan to get severely sick with COVID. All about the microbiome.
Some participants in your study continued on a plant-based diet even after the study had ended, but some did not. Why do you think that not more people continued longer on the diet, seeing the clear benefits?
So that's a really good question. You would think that once they saw the light, so to speak, biochemically, or saw what happened to their weight, or saw what happened to their blood pressure, cutting back on medications, that they would just stick to it. And we had probably about a 1/3 who stuck to it. About another third that we heard back from that they had made modifications in their diet based on the study. And then we had the 1/3 that I never heard from. Okay. And my assumption is that's because they just didn't want to admit that they had gone back. Now, there are several things about it. One of the major limitations of the study for sustainability was that we were giving them free food. And so, you know, if you're paying for your own food, that means you're buying it. You tend to buy what it is that you know about. And even though you know conceptually that what you were sent is better than what you're buying and making, it's hard to change that culture. So this is, I think, the big lesson there was, sure, we made some biochemical changes and we changed some behavior a little bit, but you really do need that coaching. You need coaching and you need education on a base fundamental at every aspect of where to shop, how to shop, what to buy, how to prepare it. And that kind of coaching is something that's critical to get someone to make a change that is really going against everything they've been taught their entire life. Even though they developed all those diseases, they weren't thinking, yeah, my grandmother's diet is what's doing this to me. So we basically are challenging their church, not that particular church. They're doing this all the time. They don't serve bad food like the one I grew up in. There was fried chicken every Sunday, and there was ham hocks in the greens, and the sodium content of the greens was really out. And there was a moment where one of my organizations, the Association of Black Cardiologists, wanted to come out and say, we've got to change the church food. And we realized it's such a politically difficult message to get out there. But we're challenging people's family background and their community and all their social networks and the restaurants that are near them. And so it's really hard to change it. I would think that if we got the message out about the science of microbiome and the outcomes, that we would have a shot at improving the diet of the American population, just if our legislators and our Centers for Disease Control would actually, and even the FDA, would actually come out and say, go vegan for COVID. If you won't do it for anything else, go vegan for COVID. Save our society from the illness. Everyone's can get COVID, but not everybody has to die. It's all about your risk.
And you mentioned COVID there. How concerned are you about the indirect effects as well of the COVID pandemic on people's cardiovascular risk? So, for example, also the potentially reduced exercise, higher level of stress,
and the higher level of eating unhealthy foods that they consider comfort foods. Now, once you've read the nutrition literature, those comfort foods are scary. My heart rate and blood pressure would go up if I was eating a vegan donut. I would just be so afraid of the consequences. But that's because I spend all my time reading about cardiovascular effects of food. So we don't generally have that message out there of how damaging even plant-based stuff can be if it's processed, if it's not whole food plant-based. And so without that knowledge base, people are, and when they say the COVID-15, have you heard about that in Great Britain? Was there a COVID-15?
No.
Okay. So COVID-19 has a 15 associated with it, except in my patients, it's typically 20 or 25 pounds that they increased during the lockdown. They would order food because the ability to have things delivered, didn't matter what it was, whether it was, the companies delivering, shoe polish, whatever, everything could come to your house. You never have to leave as long as you have a credit card and any internet access. And so people are ordering food and having it delivered, and it's typically poor food. They're not getting out as much. The health clubs are shut down. People are afraid to go out, and this is by the way, much better around the world now. People know better. But for that period of time when we were locked down, why would they lock the tennis courts? Talk about social distancing. Unless you're a serve and volleyer, which nobody does, okay, you're 78 feet away from your person you're playing with. Why would you shut that down? But, everyone was afraid. We shut everything down. And the weight gain was really tremendous. So as you were saying, the habits worsened the heart disease. Then the illness itself, it's an inflammatory disease, increasing plaque ruptures, and then increasing clotting, so thrombosis. So we did see a lot more of people dying at home of heart disease, as well as people presenting with heart attacks and myocarditis. I have to throw that one in there. And I know there's so many people who are worried about myocarditis with the vaccines, and it has been reported, typically younger male athletes, but the incidence of myocarditis with a vaccine is way less than the incidence with COVID itself. And so we really if you want to protect the heart, you do the vaccine.
Dr. Williams, thank you so much again for your time, and all the best for your further work. And I do hope to see you again in the future. Thank you.
I really appreciate you having me. Take care now.